In this video, what I want to do is I want to talk a little bit about how would someone know whether or not they're depressed and some of the warning signs and things that, I would educate any person on if I was trying to explain to them what to look for to determine whether or not they're depressed and whether or not they may need to seek out some kind of treatment to help with said depression. So let's just jump right into it and talk a little bit about first who gets depressed. So the short answer is everybody gets depressed. I don't think I've met many people who have said, I've never at any time felt a decrease in my mood or felt a sad mood, whether that involves circumstances, life circumstances, certain stressors, work-related, school-related, etc. Everybody at one point or another can identify a time where they felt depressed. So each year, approximately 6.7% of the population in the US here experiences major depressive disorder. And women, of course, are more likely to become depressed, 70% more likely to experience the major depression than men. And that also may have to do with the fact that men are probably a little more reluctant to seek treatment or to even admit that they're feeling depressed, even though they may have some of the symptoms that I'm going to talk about in the next slide. So first of all, what is depression? So people describe depression in many different ways. Some people might say, I'm depressed, and simply in those terms. Other people may describe it as sad, feeling down, feeling blue, etc., or feeling crappy. Anybody may have a different word that they use to describe that feeling, but everybody pretty much knows what that means. So depression also, it's important to know that is a disease. It's like any other disease. This is really, really critical because this is where some of the stigma of mental illness comes into play. People feel like depression is not the same as diabetes, hypertension, heart disease, and in reality, it's actually quite similar. And so don't feel guilty for having this or feel like, you shouldn't feel this way or whatever. This is not really true. It affects everything. It affects your thoughts, it affects your feelings, it even affects your physical health. Plenty of people with depression have physical symptoms, and I'm going to talk a little bit about those in the next slide. So some common causes of why people become depressed. One of the major ones that I see as a clinician almost every day is stressful life situations. My dog died, my mother died, my family abandoned me, I have no place to live, I lost my job, my girlfriend or boyfriend broke up with me, etc. Stressful life situations. And they usually involve only a couple of very, very common things. Again, death or loss, trouble with finances, interpersonal relationship difficulties, and lack of basic needs being met even. So some people actually don't have access to good food or water or just a basic place to stay at night. So these things can be very, very stressful. Family history is another important one. So if your mom was depressed, if your dad was depressed, we know that there's a genetic component to depression. So people who have a strong family history of depression are more likely to become depressed in the future. It doesn't always happen that way, but it could. Certain medications, the one that comes to mind that's very commonly tested if you've been to med school or graduated medical school is beta blockers. So if a patient's on a beta blocker, they may be more depressed. They may notice a change in their mood after starting the beta blocker. So that's one of the medications that we commonly see people suffering depression from. Drugs and alcohol. Obviously, alcohol is a depressant. It can in the initial stages of drinking make you feel better and less inhibited, but eventually for heavy chronic drinkers and heavy chronic users of drugs, it always ultimately leads to depression or other psychiatric disorders as well. So if you have depression and you have generalized anxiety disorder, if you have schizophrenia and you have a stressful life situation, you could become depressed. If you have bipolar disorder, it's very, very common for you to fluctuate between the manic episodes, which feel amazing and they feel euphoric, and the more depressed episodes. So comorbid psychiatric conditions are another thing to look out for. And I want to stress that the biological component of depression is treatable, and it's not your fault if you feel depressed. But the biological component is only one component of depression, right? Because like I said, if you have a shitty life, it's going to be very, very challenging to fix that. Meaning if you don't have access to food, access to shelter, access to the basic needs, then those things are not going to be fixed with antidepressant medication or psychotherapy. And just to give you guys an idea of how do I know if I'm depressed, what are the signs and symptoms that I'd be looking out for? So for people with major depressive disorder, they'll have a number of symptoms, and they'll have these symptoms pretty much every day, all day long, and it has to be going on for at least 2 weeks. And in order to meet criteria for major depressive disorder, they also have to have either one or two on that first list that you see on the screen. So they must have loss of interest in previously pleasurable activities. So what that means is, or what we call it, is anhedonia. And that means basically that, I used to like playing video games, and now all of a sudden I don't like playing video games anymore over the last several weeks. I've just been feeling down in the dumps. I don't want to play online with my friends anymore. So things like that. Depressed mood, obviously, again, feeling sad, feeling blue. This is kind of, or feeling just down. That's also might be there. One of those two have to be there for the diagnosis. Three would be changes in sleep pattern, and that could either be increased sleep or decreased sleep. So either people are having trouble falling asleep or staying asleep, or they're actually sleeping way more than they should be, but a change in their sleep pattern. Excessive guilt. And with excessive guilt, normally what we're talking about is like feelings of hopelessness or worthlessness, meaning like for hopeless people, I can't change, nothing is ever going to change, there's no way it can change, etc. For the worthlessness, that's kind of self-explanatory. I feel worthless, I feel like I'm not good enough, etc. Decreased energy would be another one. So I wake up in the morning, even though I slept 8 hours, I don't feel good. I can't get through my day properly, I feel tired all the time, etc. Poor concentration. So I usually ask people, if I asked you to watch your favorite TV show all the way through, do you think you could, sit there long enough to concentrate? Or could you read a chapter in your favorite novel right now? And that's a good way of kind of screening out whether or not they can concentrate through something that's a little more enjoyable than just, say, work or school-related activities. Change in appetite, and that can be, again, either increase or decrease in appetite. So some patients tend to eat more when they're depressed, and some patients tend to eat less and have weight loss when they're depressed. It depends on the person. Psychomotor slowing, or it used to be called psychomotor retardation. Basically, that's just where you're kind of slow. You're not moving fast, you're not moving with much purpose, you're just kind of monotonously going through your day. And of course, suicidal thoughts. So when you're depressed, it's very common for people to say, well, I've also thought that maybe the best way out of this situation is to end my life. That's never the best way out of the situation, but sometimes it feels that way for patients when they're very, very depressed. Some other potential physical signs of depression include things like headaches, generalized body aches and pains, stomach cramps, and even sexual problems. So with that loss of interest or anhedonia that we talked about at the beginning of this list of 9 symptoms, what you can find is that people even lose interest in having sexual relationships with their partner or significant other. So these are things to look out for if you're experiencing any of these things. In particular, if you're experiencing 5 out of 9 and 1 or 2 for at least 2 weeks, then you should think about maybe contacting either a family practitioner or trying to get an appointment with a psychiatrist and see if you do indeed meet the full criteria for major depressive disorder.